We now come to the Prime Minister's COVID-19 statement. I now call the Prime Minister.
Today's latest ONS data show clearly that infection levels are falling in England. And while there are some places where cases are likely to continue rising, including in primary schools, our scientists believe it is likely that the Omicron wave has now peaked nationally. There remain, of course, significant pressures on the NHS across our country, and especially in the North East and North West. But hospital admissions, which were doubling every 9 days just 2 weeks ago, have now stabilised, with admissions in London even falling.
And many people last week welcomed the 5-year moratorium.
So, this morning, the Cabinet concluded that because of the extraordinary booster campaign, together with the way the public have responded to the Plan B measures, we can return to Plan A in England and allow Plan B regulations to expire. As a result, from the start of Thursday next week, mandatory certification will end. Organisations can, of course, choose to use the NHS COVID Pass voluntarily, but we will end the compulsory use of COVID status certification in England. From now on, the government is no longer asking people to work from home. And people should now speak to their employers about arrangements for returning to the office. And having looked at the data carefully, the Cabinet concluded that once regulations lapse, the government will no longer mandate the wearing of face masks anywhere. From tomorrow, we will no longer require face masks in classrooms, and the Department for Education will shortly remove national guidance on their use in communal areas. In the country at large, we will continue to suggest the use of face coverings in enclosed or crowded spaces, particularly when you come into contact with people you don't normally meet, but we will trust the judgment of the British people and no longer criminalise anyone who chooses not to wear one. The government will also ease restrictions further on visits to care homes.
This cycle of new variants by playing our part in vaccinating the world.
This week, the World Health Organization said that while the global situation remains challenging, the United Kingdom can start to see the light at the end of the tunnel. And, Mr. Speaker, this is no accident of history.
Exactly.
Confronted by the nation's biggest challenge since the Second World War and the worst pandemic since 1918, any government would get some things wrong, but this government got the big things right, Mr. Speaker, and I commend this statement to the House.
Thank you, Mr. Speaker, and I thank the Prime Minister